Hello everyone, welcome to sqadia.com. I'm Dr. Sanana Rahman and today we're going to talk about shock. Imagine you have a patient, you're in the emergency room and a patient arrives, hypovolemic, hyperventilating. You don't know what to do. That is the biggest disaster a doctor can have on his hand. You have to be prepared for whatever comes in the emergency room. Shock is one of the most common things you'll come across in the emergency. In this lecture, we'll see how to manage shock, what are the different types of shock, how does the body react to the shock, and what is the role of a surgeon in management of the shock. The lecture has been divided into 5 sections. In the first section, we'll be dealing with the pathophysiology. The pathophysiology will tell us that how the body responds to shock. First of all, we'll deal with the cellular component of the pathophysiology. Then we'll move on to the microvascular component, and then we'll deal with the systemic component. We'll see how various organ systems in the body react to developing shock in the body. In the second section, we'll deal with the classification of shock. There are various systems to classify shock. However, we'll be using the most common system and we'll be dividing shock into 5 different categories. We'll see what these categories are. And we'll see how to manage all these categories. In the third section, we'll be dealing with the severity and stages of shock. That is, how does the shock progress throughout the body? We'll see how do we gauge the severity of the shock. Then we'll see the pitfalls in our system, the things you have to keep in mind and keep an open eye for. And finally, we'll see the consequences of shock, that how the body starts to shut down as a result of shock. In the fourth section, we'll deal with the resuscitation. This is the most important section of this presentation because this is what you're supposed to do with the patient in shock. We'll see how to resuscitate patients with various types of shock. We'll see the conduct of resuscitation, that is the protocol that has to be followed. Then we'll talk about the fluid therapy, the specific fluids that can be given, the amount, the quantities, and and the do's and don'ts of the fluid therapy. Finally, we'll talk about the vasopressors and inotropic support. We'll see in what types of shock these are useful and in what types these are not. Finally, in the last section, now you have a patient who has survived shock. In this section, you'll see how to monitor the survived patient, or a patient who has arrived with, and you do not know if it's shock or not, you'll see how to monitor this patient. We'll see the cardiovascular monitoring, we'll talk about the central venous pressure, then we'll talk about the systemic and organ perfusion. We'll see how the perfusion is affected in the shock and we'll see how to manage it. And finally, we'll talk about the various methods with which you can assess the improvement of shock and the efficacy of your treatment. These would include the base deficit, the decrease in base deficit, the increase in mixed oxygen saturation, and the endpoints of resuscitation. I hope you're excited about today's lecture. For further such lectures, keep watching sqadia.com.